let's talk about the future. None of us can predict what's going on next week.
Yeah.
But if we all put our brains together based upon our medical expertise and hearing what's gone on with our virus in our society and just been paying attention to life in general, yet still have our expertise with where we've been through telemedicine, our own practice of urology. Where do you see this all heading? Again, we talked about maybe pulling back a little bit. Where do you think it settles out? This is just a guess. Dr. Gore.
Yeah, I mean, the easy answer is I don't really know. There's sort of the what I hope will happen, which is sort of novel ways to think about physician medical licensure. The fact that we have state-to-state licensure, it's sort of a historical way that we've done it. But I think, thinking about your medical license being a fairly universal national thing, I think would be really great. In terms of telemedicine, I think a lot of the changes that Medicare has made, with the exception of some of the more really emergency things like the use of non-HIPAA relevant platforms, I'm really hopeful that a lot of those changes persist. As you said right in the beginning, a lot of our private payers and even Medicaid, a lot of state-specific Medicaid has been ahead of Medicare on a lot of the telemedicine reimbursement initiatives. And I think a lot of that, I hope, will persist, once this is all over. I can tell you from the patient perspective, they really do. And I know, Dr. Spitz and Dr. Rhee have mentioned this. They really want it to persist. That's been a real positive out of this. And so I think that patient advocacy will definitely help.
Okay. Dr. Spitz?
Well, again, it's not clear. I think it depends on how long we remain in a stay-at-home posture. The sooner this ends, the greater the chance that there will be a retraction of the payments and the loosening of regulations. The sooner we go back to business as usual, the smaller percentage of these advances will be retained, in my opinion. The longer it takes for us to go back to business as usual, the more these practices become more established and more the norm, and the harder it will be to turn them back. So I think a big part of the future of telemedicine rests on what the current status is with COVID and when we are going back to business as usual. Having said that, to the extent that we retain telemedicine as a reimbursed and standard part of our practice, this will have very important and profound effects on our reimbursement. Because as proceduralists, much of our fee-for-service reimbursement cannot be realized through telemedicine. And so there will be a major, I think, review and perhaps revision in the way we value our services and in the way we attempt to be compensated, at least in a fee-for-service environment, if telemedicine becomes a bigger part of our practice. That's not to say we can't find parity or possibly even thrive. And certainly on the patient side of the equation, I really don't see a downside. I see nothing but upside for the patients because, as I said before, it's not an either-or scenario. It's yes and. And so that's how I view the future of telemedicine and what the implications may be.
Okay. And Dr. Rhee?
Yeah, sure. Speculating again, I'll put that caveat. Post-COVID-19, I think the origination site that we have been always having this problem, I think patients are going to want to be connected from home. And I think that's going to have a big, profound effect on everything else. But I do believe that payers and the government are going to understand, particularly with the social distancing and the things that we're going through. I don't think any of us will disagree that this will be in the mindset of everybody in the future. So connecting from home, anything you do is going to be where I think the origination site requirement is going to be lifted. The other part of it, I think, is that the Hipaa compliance, I think, is probably going to come back. I think it's a little too loosey-goosey. The stuff we're seeing with Zoom, as an example, that we're seeing some data, that's people have been able to log on without actually getting a password. I think these things are of concern, and I think the Hipaa thing will be coming back. And I think, the medical decision-making type of billing that we're all familiar with, that's going to that's the only way you're going to have to be able to compare apples to apples and compare telemedicine versus face-to-face. You need to have some consistency as far as that's concerned. That being said, these are all guesses for all of us. I think that, in the end, literally 6 months ago, would we ever think that we'd be doing a WebEx for, our urologists in regards to telemedicine? I'm flabbergasted. I'm still stunned as to what's transpired in a month. But those are my thoughts.
Great. We basically used up an entire hour, which was our allotted time. Guys could get a cup of coffee. Could probably do this for another couple hours right now.
Right.
I do want to make not a couple plugs, but one thing we didn't get to touch on quite so much was actually the actual billing and patient management aspect of this, and how it goes to the back end. We've done a lot of the doctory stuff up front. One site which I think is really good is the American Urological Association. There's a whole COVID-19 information center. I believe on one of the slides it has the link there, where again a lot of us have done a lot of the coding, back end stuff, and the translation of a lot of the private payers, Medicaid and state laws, at least a generalization, and Medicare's laws, where you can read there. It's really you can go there, start clicking around. Find there's a lot of podcasts, a lot of billing information, which it will also really help you in anybody's journey through telemedicine. Because again, at the end of the day, we do have to keep our business afloat so we can provide care to patients. So we want to make sure that works well for everybody. There's a couple other links which are on the slide here: Center for Connected Health Policy, Alliance for Connected Care, and the Federation for State Medical Boards. Those are good links to look at individual state policies and state rules. So you may click on there to find your individual states. Then it talks things about which states you might be able to practice in, getting a license in another state, where the rules have been relaxed. So please use those also as a place where you can go and gather more information. That being said, that's our hour. Again, we got to thank the Urology Times for sponsoring this. I hope that the people who are listening, that they've learn a few things and are able to troubleshoot and to move forward for the good of our practices, the good of our patients, the good of the health of the citizens here in the United States who we're providing healthcare for across the nation, because I think things like this are good for everybody. Dr. Gore, Dr. Spitz, Dr. Rhee, your guys' expertise, allowing us to pick your brains and spending this hour with you has been great for me. I hope it's been great for everyone out there. Thank you guys very much for your leadership and all the work that you have done.